I figure I'm a little bit of an outsider at this meeting, given my affiliation with Athabasca University. So I thought today would be a good chance to give you a little bit of an idea about AU and the context within which I work. So perhaps the most common question I get is, well, what the heck is Athabasca University? Well, AU is Canada's largest distance-based post-secondary institution, and it's one of the 4 public comprehensive universities in Alberta, which serves over 38,000 undergraduate and graduate students. AU's research portfolio is rapidly growing. We have full-time faculty members who hold Canada Research Chairs, I-Core Industrial Research Chairs, NSERC and SHIRK grants, CIHR operating grants, and I'm fortunate to be the first Alberta Innovates Population Health Investigator at Athabasca University. As for myself, my primary appointment is within the Master of Health Studies within the Center for Nursing and Health Studies. We have a course-based master's program as well as a thesis-based program as well. And what's unique is our graduate students come from a variety of backgrounds and disciplines. Most of them come from a nursing background, but now we're starting to see more and more students coming from backgrounds such as kinesiology, physiotherapy, occupational therapy, community health, and so forth. And we're actually currently in the process of developing a doctoral program, which we anticipate will be about 3 to 4 years away from being launched. So the second most common question I get is, well, where the heck is Athabasca University? Well, Athabasca University is nowhere. It's kind of up in the cloud. While most teaching interaction at AU occurs online, we actually do have some physical buildings. The AU Central is up in Athabasca. It's about an hour north of Edmonton. And then we also have some building space in Calgary as well as in Edmonton. Now, courses are not taught in person. These buildings are strictly for admin purposes. So research services, human resources are located in these types of centers. Up in Athabasca, they just started construction on a new academic and research complex, which is quite exciting. Most full-time faculty at AU work from home in their home office. And actually, the majority of them live here in Alberta. It seems like a lot of them live in Canmore. Now, I live in Medicine Hat, and I've crunched the family budget numbers, and I can't seem to get that move to Canmore, but maybe one day. Now, and this leads to the third most common question I get with my affiliation with AU, and that is, so you must work in your pajamas. I'm not going to answer that question. Actually, I don't even have pajamas, so... Now, living in Medicine Hat, living in the Hat is great because it's close to family. My wife grew up there. We have 2 little kids. So it's been a great chance and a great opportunity to move closer to family. But it's also opened up some very interesting research opportunities and initiatives in a region of the province that typically has not seen these types of health-related research initiatives before. And at best, Medicine Hat, I'll refer to it as the Palliser region. I know we don't use those terms anymore. But it's not a particularly healthy region. In our region, 58% of adults are physically inactive. This exceeds the next most physically inactive region by approximately 7%. So the numbers are quite staggering. 52% are overweight or obese, which is much higher than the provincial average. And we actually have the highest percentage of smokers in the region, in the province as well. And in my experience so far, other health-related professions are quite keen to be involved in the types of health-related initiatives that we're launching. For example, the director of the Medicine Hat Cancer Centre, Dr. Mark Trudeau, and I are just launching a CIHR-funded randomized control trial exploring the role of ways of facilitating physical activity behavior for women who are starting chemotherapy for breast cancer. Yet evidence to date actually indicates that when a woman is diagnosed with breast cancer, their physical activity drops quite substantially. And only about 6 to 10% of women who are on chemo are meeting public health physical activity guidelines. Now, by collaborating in this project with the Lethbridge Cancer Centre, as well as my colleagues at the Tom Baker up in Calgary, breast cancer patients in this trial, no matter where they live, whether they're in the urban or the rural context, will actually have access and the opportunity to participate in these types of initiatives. And really, especially down in southern Alberta, that has not happened before. Now, Medicine Hat is certainly not a rural community, but it's certainly surrounded by a large rural contingent. By teaming up with the Alberta Cancer Registry, we've been able to explore some unknown questions related to physical activity behavior and breast cancer survivors who live in the rural context. Now, these are women not living in Medicine Hat or Lethbridge proper. These are women living outside of the city limits. We recently collected data on over 500 rural breast cancer survivors in southern Alberta. And we actually just submitted the first manuscript documenting clinically relevant differences in health-related quality of life and fatigue symptoms when we're comparing women who are meeting public health guidelines compared to women who are not meeting public health guidelines. We've actually also initiated some research initiatives that are strictly local to the Medicine Hat area. We just published a study looking at postmenopausal women, and again, we compared the active women to the inactive women, and we find that there's quite substantial differences in both mental and physical functioning when it comes to health-related quality of life. Now, when we're new academics, we kind of have that impression that, well, we just need to get some data in the door to get us going and get some publications out there. But what we thought was, a small study to serve that purpose has actually turned into something quite larger. That's turned into a larger randomized control trial called Step Up for Health. That's a randomized control trial looking at a web-based physical activity pedometer intervention for postmenopausal women. And this research has also led to a visiting professor adventure for myself and my family down at the University of Queensland in Brisbane, Australia. They have some leading experts in terms of physical activity. And what we're finding now is a newer area in the field, and it's more so looking at sedentary behavior. We're finding some compelling data linking things like waist circumference, BMI, and sedentary living as well. So watching TV, time spent in front of a screen, computers, driving in your car, and so forth. So in all honesty, the Australians are probably 4 or 5 years ahead of physical activity research than we are here in Canada. So being able to bring that knowledge from Australia back to Alberta will be quite exciting. So many of these projects and initiatives are made possible through my Population Health Award with Alberta Innovates. Being able to dedicate the time and resources to these initiatives really does make a difference to the health of folks living down in the more southern and southeastern regions of Alberta. And it's also, what I think is most importantly, is it's opening up and exposing a region of the province to health-related initiatives and research that typically has been largely neglected. Well, thank you.